Wilco Area Career Center, and our instructors this evening are Mrs. Bunker, Karen Aldworth, Mrs. Ramsden. They're going to take the meeting and start sharing their screens and sharing with you some information. If you have any questions, like I said, you could put it in the chat, or you can go ahead and unmute yourself and ask that question or raise your hand.
Okay. All right, we will go ahead and get started. I hope everyone can hear me okay. Let me know if there's an issue. Can definitely make some adjustments with increasing my volume. All right. So let us go ahead and get started. My name is Debbie Bunker. Like I said, I am one of the instructors here at Wilco Area Career Center. We have four theory instructors between the two sites. We have students at Romeoville, and those students, the students that come to the Romeoville campus are from the Plainfield schools, the Valley View schools, the Lockport High School, Lamont High School. We also get students from Joliet Township and Plainfield Academy. Our site at Braidwood at Reed Custer takes the students from Wilmington, from Wilmington High School, Cole City High School, and Reed Custer. Okay, so let me let the rest of these people in, and then we will go ahead and get started. All right. All right, so you are going to be starting an opportunity for a new career, okay? At the Wilco Area Career Center, you are going to be part of the CNA course, okay? There are, oops, let's do that, there we go. Your future is healthcare, okay? And that is what you have shown an interest in. And we're hoping that through this course, you'll get an opportunity to learn a lot about healthcare, and you'll get an opportunity to take care of patients and to provide high quality patient care. I'm gonna go let this run.
Deb, we can't hear the voiceover on the program.
Okay, thank you for letting me know that. I apologize. So let me tell you a little bit about our program. Our program is comprised of three main parts. The first two parts include the classroom. In the classroom, there's lecture, or in this case, since many of our schools will be starting remote, will be opportunities to learn the theory, the information that you need through Google Classroom. When we return in person, which we hope will be soon, but we'll play it by ear, we'll have opportunities to role play. And then finally, another very important piece of the classroom portion of this class is the skills practice, or the work that we do in the lab setting, okay? It is very important for the students to make sure that they get into the classroom and get an opportunity to practice those skills. Without sufficient practice, the students cannot go out to the clinical setting to take care of patients. Okay? And that's the other big piece of this class, is the clinical experience. That's where they get an opportunity to go out to one of our nursing homes that we work with in the area.
Anything here.
And they get a chance to actually take care of patients. So there's hands-on learning that takes place there. Okay? They get that real life experience that they need, so that when they are eligible for the state exam and they take their state exam and pass it, they're then feel comfortable and competent in providing high quality patient care. The other important piece of clinical is a lot of times our director of nursing at the different buildings will take a look at the students out at the clinical setting and see how they're doing. It's an opportunity for the students to kind of network and to be able to possibly have a job opportunity after they're done with the class, okay? Finally, there's the professional organization that goes with our CNA class, and that is HOSA, Future Healthcare Professionals. It's an opportunity to do some extra work outside of the classroom setting. It includes going to a variety of conferences, to a conference, an opportunity to compete on the state level for skills. And if they do really well at the state level, they'll then have the opportunity to then go to the national level to compete. Okay, our class is a dual credit class with college credit from JJC as well as high school credit from the students' high school. With successful completion of the class, the student is eligible for 6 college credit hours. Many times, nursing programs would like students to have at least completed the CNA class prior to starting the nursing classes at their college. And so this class gives them that kind of step up to that. It's also can be used for elective credits if the student chooses to go on into another area of healthcare or into just another profession altogether. Part of this class is CPR certification. The student will have the opportunity to become basic life support certified American Heart Association. Now, this class is different than probably what was given at your high school. Most of the high schools use the American Red Cross, which is not sufficient for what the students need out at the healthcare setting. Okay, so they need to complete the CPR course that we do offer here. If they're already working in healthcare, they may already have the certification, and the student can work with their instructor to figure out whether their certification is sufficient. Upon successful completion of the class, the student is eligible for the Illinois Certified Nursing Assistant Competency Exam. The earliest students would be eligible to take that test, would be in May of 2021. Okay. This is a full school year class. It goes from August until May. So the student would need to complete both semesters successfully. So what are you going to do in this class? Okay. You're going to have the opportunity to do things like brush somebody's teeth. It's one of the skills that the students need to learn. You're going to learn how to position people safely in the bed. You're going to have an opportunity to work with your peers and classmates on moving patients. Last picture just posted of a mannequin that the students are using. Okay. These students here are making beds. Bed making and doing it properly is very important. Again, another student brushing teeth. Here we have students who are practicing shaving. We use the knee because it helps to simulate the rounded areas around the chin and the jaw when students have to go out and perform shaving on a resident at the nursing home. Again, we get the students in the beds when we can be closer than 6 feet. We will have the students working in pairs or in groups in order to be able to practice the skills that they need. Okay. Another area that the students need to become competent at is applying and removing PPE. I'm sure everybody probably knows that PPE now means personal protective equipment. It includes things such as gloves, gowns, and masks. There is a proper way that healthcare professionals have to apply and remove these items, so it's something that they'll be learning in the first few weeks of their course. Okay. Washing hands is another really, really important aspect of healthcare, and it's something, again, that we'll start with at the beginning. nail care, transferring somebody from a chair into a wheelchair using proper technique and proper equipment. Okay. Practicing taking heights and weights, positioning people properly. Okay, so those are all the things that you do as a CNA student. If you choose to join the HOSA organization, there's a great opportunity to take your learning a little bit further to that next step, okay? And it's exclusively for people who want to go into the health professions. There are scholarship opportunities through HOSA. What students who are involved in HOSA can do is they can apply for scholarships, or it's usually multiple scholarships available. You apply once and then you are eligible for all the scholarships they're offering. There are competitive events at both the state and national level, which students, again, prepare a presentation, they demonstrate the skill, there's a variety of different things that they can do, and then they would go down to wherever they're holding the conference that year, if it's held this year, and they would demonstrate those skills or provide a presentation of their poster. Like I said, if they do really well, they then can go to nationals. There's also an opportunity to participate in community service. It's another big piece of HOSA. So in the past, we've gone out and we've had students who rung a bell for the bell ringing, for the red buckets, for the Salvation Army at Christmas time. So a variety of different things that they can do. There's a group of our students as they are about ready to head down to a HOSA conference. State competitors, I mentioned this before. Again, if you choose to want to compete, it gives you an opportunity to practice your presentation skills, to practice demonstration of skills. And then there's a group that we did take down to state.
Open doors for you to get, that'll make you friend.
And then there are students that did really well and ended up going to nationals.
Students need to know what they work.
Okay, the year that, many of these pictures were taken the year that our students did go to nationals. And we frequently send one, maybe two groups to nationals. Okay, community service. Talk a little bit about what they've done. Here's a picture of the students who've done the bell ringing one year. In the past, we have assisted with the blood drive. I don't think we're going to be hosting the blood drive this year just because of the situation with COVID-19. Lots of opportunities. All right. So let's talk a little bit about the clinical experience. It is going to be at one of the local nursing homes. If you're at Romeoville, depending on what happens second semester, it may be during one of your clinical days or one of your days that you would come to class. That's normally how we've done it. So instead of coming to class one day, you would go out to the site. We'll have to see what happens with when students return to the classroom. We also are awaiting orders from Governor Pritzker about when we can get back out into the nursing homes, okay? Reed Custer typically schedules their clinical experience on Saturdays for 4 hours. Okay? So please understand that things are going to be very different this year. At the moment, we are not required to do the same number of hours that we did in the past at the clinical sites. They're giving us the opportunity to be able to complete some of those clinical hours in the lab setting where we have to do lab simulations with mannequins in order to make sure that the students know how to safely provide care.
What?
Every student will have to purchase a CNA scrub top. Okay. Let's see. There we go. Hold on a minute. I want to show you our scrub top, but I cannot find, I'm missing the thing. We'll do this in a little while. All right. So anyway, we've got a scrub top that the students need to purchase. It's khaki in color. It has navy blue writing on it. It identifies the student as a Wilco CNA student, and it also has their name embroidered on it. Okay. The students must purchase that scrub top. It costs $25. They are able to purchase their own scrub pants if they choose. They must be scrub pants. They cannot be sweatpants or jeans or anything like that. They must be navy blue in color, and they must have elastic waistband all the way around the top of the scrub pants. Okay. We also will make available to the students an opportunity to purchase scrub pants for $15. Or you can go to Walmart, you can go to a uniform shop, and you can purchase your own scrub pants there if you choose. Okay. All right. Once you get out to the clinical setting, once we get out there, you will have an opportunity to care for nursing home residents. Okay. And I would say that about 85% of my students tell me that that's one of the best parts of the class. They absolutely love going out, meeting the residents, getting to know them, having the opportunity to be able to provide that patient care. So to be eligible to take the state exam, what are the requirements? You need to successfully complete the class with an 80%. That means an 80% in the classroom or theory portion of the class, as well as an 80% in the clinical portion of the class. Okay. There are 21 required skills that students are required to demonstrate. They have to sign off all 21 skills. We have a fairly rigorous attendance policy due to the fact that the Illinois Department of Public Health, which oversees this course, states that the students must have so many hours of theory and so many hours of clinical every year. So it's really, really important that the students are completing all of their work in Google Classroom, that they're coming in and doing the lab work that they need to do so that when they can get out to the nursing homes and do the clinical hours out in the nursing homes, they can get everything done. If one of those areas isn't met, they didn't get the theory accomplished, they didn't pass it at the 80% level, they don't get their skills signed off, or they don't get their clinical hours completed, we cannot release them for the state exam. Okay. In order for them to go out to the clinical setting, they do have to have a criminal background check done. And what that looks for are big things like, were they involved in a murder or something like that? It's basically to make sure that they're safe and they're not going to pose a threat to the residents.
We are working on a uniform shop.
So what have our graduates said about our program in the past? Caitlin writes, knowing you can impact a person's life, either in a nursing home, hospital, or just a person that needs help changes you. And knowing that you physically can do this is life-changing in itself. The student went on to be a CNA and then went on to nursing school. Wilco is one of the best programs I have ever been in. The teacher made me feel like I could truly become a CNA. That is our goal. Our one and only goal for our program is to be able to help your student or help the student meet their goals and to be a successful CNA when they're finished. Wilco benefited me by giving me hands-on experience working at the nursing home. This class made me learn how to use time wisely and set my priorities. That is another goal of Wilco, is to give students the opportunity to be able to test run a career or to try out a career. Every year I have one or two students that say to me, Mrs. Bunker, I really loved your class. I learned so much, but I found out that I don't like to take care of sick people. It's just no fun. And my response to that is fantastic. You just saved yourself 1 or 2 years of college plus all the costs, starting down a nursing program that you just wouldn't have been happy in. So that's what students here at Wilco get to do. They get to test run careers.
Start when you start school, or does it start never in the year?
Alyssa says, Wilco has taught me that being in healthcare is my future. No matter what we did in class, I was always learning something new. And that is true. From the day you start till the day you end, we are always introducing new things, new concepts, new information, new vocabulary. It's a full year of learning new things. Okay. When we started learning how to care for other people and meet their needs, I realized this was serious. Other people were going to depend on me. I gained so much knowledge that I can apply to a future job and future schooling. And the student realized that this was the right career path for her.
We have to wait until the.
So the question now is, what are you going to write on your piece of paper? These were letters that students wrote from at the end of their year with us, and then they were shared or they were written to be able to give to students who were coming in the following August. And so some of these were the things that they shared with us. So the question is now, what do you look forward to doing, and what is your year going to have?
Which of the principal at the end of the presentation. Students can change to medical assistant.
If everybody could please make sure they're muted. I know I've had a couple people who have popped in with their voices. All right, so let's move away from there.
I don't know.
The next thing I'd like to do is to let's see here. There we go. That allows me to do what I want to do. All right, so let's go over the syllabus for the class so that everybody knows what the expectations are. Here we have a list of our instructors. We have two types of instructors. We have theory instructors and clinical supervisors. The theory instructors are the ones who are in charge of making sure the theory gets completed in class and in the lab work gets completed. The clinical supervisors are there to help us with the lab work to make sure that everybody gets their stuff done. They also help us supervise students out at clinical. Okay, theory instructors do get to also go out to the clinical setting. Students will complete all of the Illinois Department of Public Health requirements and receive a final score of 80% or above to receive the 6 credit hours from Joliet Junior College, as well as to get their grades from their high school. Okay. If somebody for some reason doesn't meet some of these requirements, they're always welcome to stay in the class for high school credit. Doesn't mean that they have to leave the class. It just means that they aren't eligible for the state exam and they're not eligible for the college credit. Our philosophy, our goal is every year is to help the students reach their goal of becoming a certified nursing assistant. Okay? So we do that through providing the opportunities that they need to learn the things that they need to know. We do it under the procedures and standards set by the Illinois Department of Public Health. Okay? The students normally have to complete 40+ hours of clinical experience in order to be able to take the state exam. At this current time, that has been reduced to make it easier for us to be able to get students out to the clinical setting by the end of the year, because many of the nursing homes aren't accepting students right now. Okay. At this point in time, we know that it'll be either late fall or winter time at the very earliest before we'll be able to take students out to clinical. So it's very important that this fall, the students get them into the building, into Wilco, and get an opportunity to practice those skills that they need in order to go out to clinical. Every student that completes the course will get 3 credits for their high school. You get 1.5 credits in first semester and 1.5 credits in second semester. The Joliet Junior College credits become available to the student after the completion of the second semester. They have to take both semesters of the class in order to be able to meet the requirements for Joliet Junior College. We follow the same program as Joliet Junior College. They go a lot faster. They do it in a shorter period of time. But we teach all of the same things, and very similar to what they teach over at the college as well. And our goal is the student's going to pass their certification exam on the first attempt. Some other things for the students: they must be at least 16 years of age, completed 8 years of grade school or elementary education. Students must be able to speak and understand the English language, be in good physical, mental, and emotional health, and the American Heart Association BLS CPR certification, it must be completed prior to the start of their clinical experience. Our textbook is Mosby's Essentials for Nursing, 6th edition. Your ISBN number is there. If you would like to purchase the book on your own, you're welcome to do so. You may purchase the book from us for $50. If you don't choose to purchase the book, you are able to check one out from Wilco. We will loan one out, and the expectation is it'll come back to us in similar condition that it was checked out in at the end of the year. So what is the student going to learn? Everything that they need in order to be a nursing assistant. They're going to be able to name body systems and describe main functions. Again, competently perform all 21 of the state required performance skills. They'll be able to demonstrate effective ways to care for residents with Alzheimer's disease and other dementias, perform CPR, demonstrate respect for the resident as a physical, social, psychological, and spiritual being, and then be able to complete personal care for their assigned residents. Supplemental materials that need to be purchased include the khaki Wilco scrub that I talked about with the navy blue scrub pants. Okay. The student must also have a pair of white shoes, either leather or vinyl. They will need white socks. Okay. And these are required for clinical. The shoes need to be either leather or vinyl because sometimes things get spilled on them and they need to be easily wiped off. There can't be canvas because the item, if something liquid-like gets spilled on the shoe, it'll soak right through the canvas, okay? So a typical running shoe might work. You can use some nursing shoes. The big thing is you cannot use Crocs and you cannot wear backless shoes. These shoes must fit around the person's foot snugly. We will be lifting people, we will be moving people in the bed, and we don't want people's feet to fall out of their shoes as they're providing this care to the residents. The students will also need a working watch with a second hand. So a watch that has all 12 numbers on it with a smaller hand that goes around once every minute. That is what is required for the watch. They cannot take out Fitbit watches, Apple watches, those kinds of things. They can be damaged as we're working with the residents, and we don't want anybody to incur that great expense because their watch was damaged at clinical, and it has happened. We've had students take their watches off and put them in their pocket only to fall out and get stepped on or get wet in the shower and be ruined. So we tell students that it needs to be a regular watch with a second hand. The students are also required to complete a physical exam. They need to see their doctor. Many students have already completed that exam because they needed it for their senior year. We do accept the state health form that's submitted to the school. The only difference is there's a special part on our physical form, which I'll show you in a few minutes, that needs to be signed off by the doctor. And we have to have that statement that says that the student is in good physical condition and is able to do all the work of a CNA. So if you've already had your physical done, a lot of times if you just submit that form to the doctor, ask them to sign it, they'll sign it off for you pretty quickly and you'll get it right back. The second part of that is a two-step TB test. It's checking for tuberculosis, okay, or whether you've ever even been exposed to tuberculosis. So what happens with the TB test is you'll go in and you have to get a little shot on the forearm. And then 2 to 3 days later, you have to go back and have that site read. That's step one. So there's 2 visits for the first step for TB. Then a week after the first shot, you need to go back in and have the second shot given. And then 2 to 3 days later, have that read. Okay. There is another way to get checked for tuberculosis. You can either have a chest x-ray done or there is a blood test called the quantiferin blood test. Some insurance companies pay for it, some don't. And so please note that those are your options, but we do have to have either the TB two-step test or the chest x-ray or a copy of the lab results to know that the student is negative for tuberculosis before they go out to clinical. And then of course the CPR we've talked about. So how is your student going to learn everything that they need to know? Again, normally it's lecture. We're right now going to be presenting most of our information through Google Classroom. That is the platform that we will be using this year. So we ask the students to, they'll have to complete all the work on Google Classroom until we return to school. There's the lab portion, which I talked about, where they come in, they practice those skills that they need to sign off on prior to going out to clinical, or practice prior to going out to clinical. And then there's the clinical rotation. They have to complete all 3 portions of the course to be able to take the CNA exam at the end of the year. If they don't meet the expectations on all 3 of the 80%, or they don't get their skills signed off, then they will not be eligible for that exam. Okay. Again, they need to be able to do basic math, addition, subtraction. Some fractions is required, not a lot. Knowledge of biology and anatomy helps. So what does the class look like? There's quizzes after every chapter or after every 2 chapters where we check to make sure that the students are understanding the information that we're giving them. Every quarter, there is a module exam. Okay. This exam is really important. It's a cumulative test of understanding for everything that they've learned so far. So one's given at the end of first quarter, which is usually about mid to late October. The second one is given at the end of the first semester. Module 3's test is given usually in March, and then the 4th one is given at the end of the year. There is also a comprehensive final exam at the end of the 2nd semester, and this is similar to a CNA state exam. So the students need to score an 80% on that, as well as on the combination of the module exams. They will be monitored in the clinical setting, and they'll be evaluated. And again, they need to reach that 80%. We do have some special projects we do throughout the year. We may have to modify when these get assigned and how they get graded, because again, the longer that we're remote makes it a little bit more difficult to do some of these things. But things we've done in the past included in interviewing a resident. We'll have to push that off until we can actually get into the nursing home to talk to the residents. We have them put together a poster to demonstrate a skill, to show that they understand how to complete the skills. We usually have them do some kind of fluid or dietary tray, and then we have them write a Alzheimer's disease research paper at some point in time in the year to make sure that they have a clear understanding of Alzheimer's disease. Okay, so how are you graded? Again, 80% is required in each of the areas of chapter quizzes. We're going to take the module 1 exam and the module 2 exam and average them together, and that average needs to equal 80%. We'll average module 3 and 4 exams, again, needs to equal 80%. And then the comprehensive final, again, needs to be 80%. The 80% comes from the fact that that's what is necessary to get a C or a passing grade from JJC. And an 80% is about what the state says is required in order to pass the CNA exam. So there is multiple reasons why that 80% becomes so very important. So let's take a look at the grading scales for a moment. At Wilco, it's very similar to most of the high schools. We use the 90, 80, 70 grading scale. But please note that the JJC dual credit grading scale is different from the Wilco grading scale. An A from JJC is 94% and above. A B is 88% to 93%, and a C is 80% to 87%. A 79% or lower, the student will be dropped from the JJC portion of the class and from being eligible for the state exam because they're not understanding the content at the level that they need. But please know that we as the instructors are here to work with your student and help them achieve that 80%. That's our goal. We want every student that wants to do this work achieve that 80%, and we will work with them.
Join.
Okay. Here's a breakdown of how the grade comes together. 30% of the grade comes from the chapter quizzes. 10% comes from the module exams. Chapter assignments are usually 10% of the overall grade. The participation in lab is 20% of the grade. Clinical site performance is 20% of the grade. And again, the special projects are 10%. We look at the student's grade at the end of every semester, at the end of the first semester, to make sure that they're still meeting the requirements for that state certification exam. We don't want anybody to get to the end of the year and for them to find out that they're not eligible for the state exam. You will be hearing from us. We'll be working with the students. We'll be contacting the parents if and when we have a student that is in one of those situations where they're not meeting that 80%. Okay. The program is required to do 100+ hours of theory work and 40+ hours of clinical content. Again, some adjustments have been made in these areas in order to accommodate the fact that we are working online. So we use the completed work from Google Classroom to prove that the students are putting in the hours to be eligible for the state exam. And again, like I said, right now the state has lowered the requirements for being out at clinical. They don't have to complete all 40 hours at this point in time. We can do some work in the lab to simulate patient care. Okay. We do ask that students put away their electrical devices, and their electrical devices are not allowed out at clinical. Phones should never be at clinical. It's a requirement of all of our nursing facilities that the students not come into the building with a phone. I'm sure you've seen news reports where they've had staff who have taken inappropriate pictures or videos and posted them online of the residents. And so the nursing homes have asked us to tell our students no phones in the clinical setting. If there's a situation where, you know, something's going on, we will work with the student, but the students cannot bring their phones to clinical. We also tell students to put their phones away when they're in the lab area as well, because I've had students who have laid down in a bed to pretend to be a patient. They lay down and they crack the screen on their phone. So phones just need to be put away during the entire time that they're working in our class. It's to protect the student, protect the phone, make sure that nothing is broken and nothing gets damaged. Again, let's see. Again, completed physicals necessary, chest x-ray, quantiferin blood test, or this two-step MAN2 is required for the student to go out to clinical, okay? Fingerprinting background check, I'll talk about in just a few minutes. We've talked about all of that. Again, you need to have the TB test, the physical exam, the CPR certification to go out to clinical. You need to maintain that 80% to stay out to clinical. You need to be working on your lab skills to show that you know how to safely care for patients. We don't want to send anybody out to the clinical setting who doesn't know what they're doing. We're working with people and people's lives, and we don't want to put either a resident or a student or an instructor in danger because people don't know what they're doing. So it's really important that students get that opportunity to practice and sign off on their skills. And if they're struggling with a skill, we will be happy to work with them to help them be successful. But again, they need to successfully complete their skills. If they don't meet the requirements of the class, again, we do reserve the right to remove them from the clinical experience for safety purposes. All right. The state does tell us that we're only allowed to take 8 students out to a clinical setting per single instructor. So when we do start sending students out to clinical, we are limited as to how many can go out and who can go out with an instructor. We make the determination about which nursing home a student uses is based on their home school. We try to provide the students with one that's close to their home school. So in normal circumstances, when they were going from their home school to the clinical site and back, they were minimizing the amount of time they were on the road and the distance that they had to travel. One other piece of clinical that I do want to mention, I have not done so, is a student needs their own transportation clinical. I know that it's in the course description at all the high schools that the students should have a way to get from home or from their high school to the clinical setting. We do not provide any busing. In a typical year where the student comes from their high school to Wilco, there's a bus that brings them here and returns them back to their high school. This year, but for clinical only, there is no transportation. The student must provide their own transportation. Okay. When the student is in class or in the clinical setting, we expect them to act like a professional. We are a career center. We're trying to teach students how to act and behave when they're at a professional job. So we expect the students to behave in such a manner. So we expect them to be respectful, not to be argumentative or rude, to treat everybody with respect, the same kinds of things that most people would have to do in a normal work setting. Anybody who's found under the influence of alcohol, illegal drugs, or controlled substances will possibly be removed from the clinical rotation immediately. If you are impaired, you cannot provide safe patient care, and so you are a danger to the patients. In attempts to maintain that professional behavior, there's also professional appearance. So we ask the students to come to both class and to clinical dressed appropriately. When you come to class, you need to be covered. So no low-cut tops, no low-rise pants, no short shorts. The shorts or skirts need to be the length of the fingertips, and we do enforce that here. Okay, they're welcome to wear a tank top, usually with something over the top, a sweater, a jacket, whatever. We do ask the students to kind of cover up a little bit. Again, we are a career center trying to project a professional behavior, professional attitude. Okay, at the clinical setting, they need to come out in their clinical scrubs. Okay, they need to be clean. They should be washed after every clinical visit. If you take your top, throw it in the washer, put it in the dryer, and then hang it up as soon as it's done, it doesn't even need to be ironed. Okay, but we can't have students storing their clothes in their trunks for a week on end and then pulling them back out looking like they slept in. They have to come to clinical in a freshly washed top that looks like it hasn't been in a ball in the corner somewhere for the last week. Okay, it needs to be look pressed. Shoes need to be kept clean. Hair needs to be pulled up. It needs to be pulled away from the face, and we'll talk about that a little bit more shortly. Lab practice, again, is a really important component for the students to get a chance to practice their skills. So I know many of our students are starting remotely. We're in the process of figuring out exactly how and when we're going to get students in. So please bear with us as we make some of those decisions. One of our feeder schools didn't notify us of their plans to return to school until Friday. So we're still working out some of the details, but I'll show you where you will be able to find more information as we go forward. Okay. Clinical. We as students and instructors in the facilities are guests to the facilities, and so we need to maintain a professional attitude. We need to follow all of the procedures and policies for the facility. If somebody doesn't, we will be working with them to make sure that they're providing the highest level of quality care that they can, as well as making sure they're maintaining a professional attitude and behavior while they're out there. We need to make sure we keep these residents safe. Any incident that could endanger either the student or the instructor will be addressed immediately by the clinical instructor, and then the incident will be reviewed by the theory or instructor in consultation with Wilco administration. Okay, safety is our biggest key. It's the thing that we worry the most about. We want to keep the students safe, the residents safe, everybody safe, because people do get injured in healthcare. Okay. What does the student need? They need their scrub top, their navy blue uniform. We've talked about shoes, watch. They also need a spiral notebook, a small spiral notebook, and a black pen. They must use black ink. We only use black ink in healthcare. Hair will need to be pulled back away from the face and must be neat and clean and arranged up off the collar. So buns, clips that keep the hair up off the collar is fine. Please understand you cannot be messing with your hair while you're at clinical. Hair does contain germs, so every time you touch your hair, you have to go wash your hands, because you're working with people who are who may be sick, who aren't in the best of health, and so it's really important that we prevent the spread of infection. Okay. Makeup should be kept to a minimum. No strongly scented perfumes or deodorants. We have had students who've gone out with a perfume or a strongly scented soap. A resident who wasn't feeling well smelled it and proceeded to get sick. So it's really important that we don't do that. Many people have allergies to scents, so we need to make sure that we don't go out with strongly scented deodorants or perfumes. No perfume at all is allowed, or strongly scented soaps. Facial hair on men must be kept short and clean, clipped. They are allowed to wear beards, but they just need to be kept short and neatly clipped. No chewing gum is allowed. No sweatpants, no stretch pants, no colored socks, hats. Jewelry, the only jewelry that students are allowed to wear is if they have a wedding band. That is the only thing they're allowed to wear to clinical. No earrings, no facial piercings, no necklaces, nothing along that lines, okay? We've had issues with residents pulling on jewelry, with jewelry getting in the way of resident care. It becomes a danger to the student, it becomes a danger to the resident, so all jewelry must be removed. No visible facial or body piercings are allowed. Now again, if somebody has a belly button ring and we can't see it and it's tucked safely under the scrub top, you know, we're not going to be inspecting that. But we have had students whose belly button rings have gotten hooked on a side rail and they've gotten pulled. So please understand that even though it seems out of the way, injuries can occur. So we do ask that there are no body piercings. No nail polish is permitted. This is from CDC guidelines. There was a case of a woman, a nurse, who was working in an ICU. She had the false nails, the nice ceramic nails over her own with nail polish, and it turned out that she had bacteria under her nails, and with each of the preemies that she was working with in the NICU, they were getting sick. And they finally traced it back to this one woman and her nail polish and her fingernails. So it's really important that students do not wear nail polish to the clinical setting. Nails must be kept short and filed, no sculpture nails, no artificial nails. Body tattoos must be covered. So if somebody has a tattoo on their arm, they need to wear long sleeves and cover the tattoo. Again, we're going to go over the general attendance rules just so that you're aware of them, but please understand we are making some modifications to adjust for the fact that many of our students are starting remote. Students can normally miss no more than 12 school days for an entire year. On the 13th day, they'll be removed from the clinical portion of the class, making them ineligible for the college credit as well as for the state exam. They are welcome to stay in the high school credit. This piece will be worked on once we see when students start to return to the classroom, and we'll make modifications as we need to. If a student is unable to complete work from home because they're sick, it's a requirement that they let their theory instructor know what's going on and why they're not meeting the requirements for the theory work or why they're not coming in. Normally we require doctor's notes. If somebody has a court date, we ask for the court note. If there's a funeral, heaven forbid, somebody has to attend a funeral, we ask for, the funeral flyer or program or something to let us know they were at the funeral. Then anything that's missed during that time is then excused and they're allowed to make it up. Unexcused absences given by the homeschool result in a 0, and that can include a test or exam. Okay. Clinical attendance. Clinical is extremely important, especially this year. So when a student is assigned to go to clinical, they need to go. If they miss, they can be withdrawn from the state exam and from the college credit. So it's very important that if your student is signed up to go to clinical, they get those hours in. As always, we understand people get sick, something comes up, there's an emergency. So if they miss clinical time, they are required to pay for the makeup time, but they have to make up the hours. There's no budging on that. They've got to get all their clinical hours in. Okay. When and how that gets done will depend on the circumstances at which we're dealing with at the time that we're able to go out to clinical. Retake policy, only under special circumstances do we allow individuals to take retakes. There's usually only one allowed per year, and it's in consultation with administration. Okay. We talked about the comprehensive final being given at the end of the second semester. Academic honor code, we expect the students to be honest, to show responsibility, organization, recognize the importance of being accountable for the behavior, doing their own work, those kinds of things. Student handbook, I believe is in the past has been available online. I believe that'll be the case again this year. So I will show you the Wilco website shortly and show you where you can find certain things. Sexual harassment is not tolerated at Wilco or at the clinical site. We foster an environment that includes respect and trust of all students. If there's an issue, we will work with that student one-on-one. Again, safety is our biggest concern, especially now as we're dealing with COVID-19. We want to keep students safe, we want to keep residents of the nursing home safe, and we want to keep the instructors safe. A little bit more information about HOSA is here for those who want to get involved in something outside of the typical time that they spend here at Wilco. We encourage anybody that's interested to join. The membership fee is $30 and it's for the entire year. After that, you will find the information that will be covered during the course of the year. We're going to start the year off with Module 1, and we're going to complete these chapters, and we're going to get our CPR done. Then we'll move on into Module 2. Please understand again that the longer that we're all remote, we might have to make some adjustments to the course in order to make sure that the students are getting work that they can complete safely at home, or they have things that they can do at home. There are some topics that need to be covered prior to them going out to clinical. So again, adjustments may be made based on when we can return to the clinical setting. Okay. All righty, so let's take a look at the clinical rules here. Oh, hang on just a moment. I'm trying to drag the screen down just a little bit and it keeps wanting to do that. All right. Yuck. There it is. Sorry about that. My screen does not want to allow me to do what I wanted to do here. All right, so let's zoom in on this a little bit. These are our rules for going out to clinical. Rule number 1, fingernails must be kept short in length. We talked a little bit about that. Elderly skin is extremely fragile. Nails should be no longer than 1/4 of the inch from the nail plate or the end of the nail. Okay, and again, it's CDC guidelines that tell us that no artificial nails or nail polish is allowed in the clinical setting. Rule number 2, no jewelry. We talked about that. Again, that includes all earrings, necklaces, facial or body piercings. Okay, you can only wear a watch with a second hand. Proper clinical attire, again, includes the khaki top that the student needs to purchase from us for $25. They can purchase their own navy blue scrub pants. They need to come to clinical, wrinkle-free, in the proper uniform, with the proper shoes. If they choose to purchase a gait belt, which is optional, they need to have that with them. Visible tattoos need to be covered. Students can wear a plain white top underneath their uniform top. Sometimes uniform tops are a little loose at the top, and so they feel more comfortable. A student may feel more comfortable with a top underneath, okay? But it can't be a print or flowers or something like that, because sometimes that is, you are able to see that through the clinical uniform. Same is true with undergarments. All undergarments need to be solid colored, white, tan, beige, in accordance with body coloring, okay? Because again, we can sometimes see through the tops. You can see the outlines. We've had students who wore bright pink undergarments. You could see those through the clinical attire. So please make sure that you're wearing appropriate undergarments, okay? Rule number 4 refers to cologne, aftershave, grooming products, soaps, shampoos, body washes, lotions that have strong scents. Okay? They're not allowed at the clinical setting to prevent allergies and sensitivities that some of the residents may have. Violation of any of these rules can lead to the student being asked to sit out of a clinical setting, in which case they'll have to pay to make up the time that they missed. Okay? If for some reason this instructor is unavailable to make a clinical session, the student should be notified through an app that we use called Remind, which allows us to text directly to their phone. But if they arrive at clinical and do not find an instructor there, they are supposed to call Wilco and confirm what's going on. Okay. Again, attendance is a huge piece of this. Students are expected to attend class when they're supposed to be here. If they do have a court date, medical absence, we ask that documentation be provided to your your theory instructor within 7 days of the absence. Okay. Again, you need to make sure that you complete all your clinical time and that you complete all your theory work. All right. In the past, again, at the Romeoville site, what has happened is the student has gone out once a week for 2 hours at a time for 22 weeks in order to get their hours in for clinical. So they were allowed 2 clinical absences in order, for a case of I was ill, I wasn't feeling well, wasn't able to come to clinical that day. Depending on how we have to run clinical this year, we may have to make some adjustments again to the clinical policy about absences. So please, again, just bear with us as we try to figure this out as we go through, okay? Students, if they're not feeling well, should stay home. If you're running a fever, if you have body aches, if you have chills, if you have diarrhea, if you're vomiting, please don't come to class, don't come to lab, and don't come to the clinical site. All right, because we don't want to spread anything to our elderly residents or to other students. Again, maintain that 80% average in all aspects of the class is important. Or if somebody does not meet the expectations, they could be removed from the theory portion, from the clinical portion of the class, and allowed only to receive the high school credit. Okay. Again, anybody exhibiting aggressive behavior at Wilco or the homeschool, and please understand, stuff that happens at the homeschool does affect your ability to stay here at Wilco or to complete your stuff here at Wilco. We can't, if a student is fighting or having drug issues at the homeschool, again, there are issues here as well.
Not so much sick, you're going to a nursing
Can everybody
home.
please make sure they're muted? Thank you. Any violation of resident confidentiality or student confidentiality could be an activity that would result in removal from the clinical experience. Students are taught not to go home and talk about Mrs. Jones, who's at the clinical site, because it's not for, it's to maintain HIPAA, healthcare information. We need to protect that at all costs, so students are not to be sharing that information with others. And if a student puts a resident in emotional, physical, or jeopardy, or repeatedly disregards the policies of a clinical facility, is another reason why we might remove somebody from clinical. And again, no texting, no social media, no emails, none of that kind of stuff during the clinical session. All right, here's a copy of the physical exam form that we have asked students to complete. Okay, this first page has demographic information, name, address, homeschool, things like that, who we can notify in case of an emergency. Your student comes to Wilco, suddenly gets ill, we need to contact you. Who are we going to contact? Okay, the back side of that sheet needs to be completed by a physician. Now, this first part that asks about whether the student different areas are within normal limits or if there's an abnormality, that is the same as receiving the student's school physical, okay? That part does not need to be repeated if the student has completed a physical within the last 6 months, right? Now, regardless of whether the student has the school physical or has this form filled out, we do need this statement at the bottom of the sheet signed. It says the student is able to participate in all aspects of the course, including clinical, without restrictions. Okay, we need that statement signed before the student can go out to clinicals to make sure that they're safe. I talked about the tuberculosis test, the TB test, the two-step test. This is the form for that. The information about how to get that done is at the bottom. Again, you go out on the first date, you get the vaccine, you get it read, the nurse signs it off. On the second date, which needs to be 7 to 21 days after the first dose was given, They can get the second dose. Again, has to have it read within 2 to 3 days, and then the signature. If there's a problem doing that, or if you don't want to be tested with the tuberculin needle, or if you've ever tested positive for TB using the 2-step test, you should then either get the chest x-ray or the blood test, the quantiferin gold blood test. Okay. So that is the TB test. All right. Yep. Okay. There's a copy of our healthcare worker background check. Okay. Student needs to fill this out completely, printing so that it's legible. Okay. This information is read and then entered into a database. Once we have all this information entered into the database, they receive a form, and it's that form then that allows them to get their background check. We do the background checks here at the school, but if for some reason your student isn't able to come in on the days that we're doing the background checks, then they may have to go on their own time to be able to complete it. Please understand that where it says race, it's looking for a letter from below. Those are the limitations per the state of Illinois. We did not choose those different ethnic racial groups. Those are the groups as identified by the state of Illinois, and you can only choose one. Okay, so I apologize if somebody's of a mixed race, or if they don't feel that their race is represented fully on there, but this is the state of Illinois that has written this form, so I apologize in advance. Your student must have a social security number to be able to take the state exam, okay? They need it for their background check, and they will need it in order to register for the state exam at a later point in time. So if your student does not have a social security number, you need to work on getting that taken care of now, because it usually takes several months to get that processed. Okay, if you have questions about a social security number, please feel free to contact us and we'll be happy to work with you on that. Okay. All right. All right, so let me pull up the Wilco website. All right, so here's the Wilco website. When you came to the meeting, you probably clicked on here. Let me show you some other important pieces of this website. If you go to programs up here at the top, you scroll down to nursing assistants. There you have all of the instructors that are involved in our program listed here. If you go down to CNA forms, there's some really important forms for you to be aware of here. I'm asking everyone to please this evening or first thing tomorrow, complete the student registration form for us. This is how we're going to get in contact with you in order to get your students set up in our program. We understand that most of our students are coming to us remotely this year, so it's really, really important that you complete this. So put in your email address. We need the student's last name, their first name. They can choose their high school that they come from, their home high school. We need a cell phone number. The reason we ask for a cell phone number is one of the apps that we use for communication with your student is Remind. What happens, we can send out a remind message to all the students in a class. That then becomes a text that goes to their cell phone. Or if they choose to download the app, it'll be something that appears in their app. So that's why we need a student cell phone number. I have had students that did not have cell phones who's used a parent cell phone number. So please understand that parent cell phone number is sufficient for what we need. Okay, but we need to be able to get hold of your student early, first thing in the day, so that if there's an issue, we can communicate with them. Again, email address, we need your street address. Where's your home located? If we were to send you a letter, where should we send it? So street address, city, state, city zip code. And then we need parent information, parent contact information. We need a phone number and an email address. Again, mailing address for some parents or guardians. And then what is the best way to reach the parent or guardian? Some people prefer email, some people prefer phone. So please indicate that for us. And then finally, what language is spoken at home? so that we know what students are doing at home, as well as if we need to contact a parent, we know we need to get an interpreter. So if you could please do that for us this evening or tomorrow, we would greatly appreciate it.
Deb, can you please show them again where that form is? I'm getting some chats that they missed where that form is at.
Sure, be happy to. So I'm going to go back to the home page for the Wilco website. Our home page is at www.wilco.k12.il.us. If you go under programs, scroll down to certified nursing assistant, move to the right, and then it's under CNA forms. Okay. And here's that registration link right there. Right below it, you'll see the link for the syllabus, which I went over with everyone this evening. If you did not receive a letter from us, there's a copy of the physical form that I showed you and the clinical rules. And again, the criminal background form is also available. You'll need to print that out and bring that into us. Okay. So there are the forms that we have right now. Please know that as we get more information, we'll be posting it here on the Wilco website. It's a general place that people can go to get information. So please check this, a couple times a week to make sure as we get more information and as we get going, now that we have more information about what our participating schools are doing, we'll be posting it here. Again, as we get registration information, we'll begin to contact students individually. Okay. So going back to that home page again for Wilco, that front page at www.wilco.k12.il.us. The other place you need to go is students and parents section. You've got a lot of information here that's very helpful. Let you look at that at your own leisure. Fees is the other thing. If you click on the fees, you'll come here to this page. Go over here to online payments, okay? When you click there, you should be sent into the opportunity to purchase our payment system. I'm thinking that because of the weather this evening, we've had issues with the server that has the payment. So unfortunately, it's not working tonight. I can't lead you all the way through it. But please feel free to pay your fees there online. It'll make it easier for your student. Okay, fees for the scrub tops need to be paid prior to the fitting for the uniforms. We will have our uniform supplier come into our building. They will give the students an opportunity to get fitted for the uniforms, so the fee needs to be paid prior to that. For the background check, prior to bringing those people in to do the background checks, we need the fees paid. Okay? And the forms filled out and submitted and things like that. Again, all that information will come once we have a better understanding of how we're going to be able to get people into the building. Okay. Before your student's allowed to take the CPR course, again, the fee will have to be paid. And all of that will be communicated to your student through their theory instructor as we move through. Okay, so those are the fees. All right, those are all the information that I have at this point in time for everyone. So I'm going to flip back. Where's the stop share? Here we go. I'm going to flip back here, and I'm going to go ahead and start taking questions. I'm going to go into the chat room. Okay. And we'll go back up to the top and we'll start at the very beginning. Okay. Ruth Adoma is one of our clinical supervisors. All right.
Hey, Deb, I think we've gotten most of the questions as we've gone along.
Okay.
If anybody has something, you can unmute yourself at this time if you'd like to ask, but I think we've done a pretty good job.
Okay. Are there any questions? We'll open it up to anyone who has questions at this point in time.
Yes, I have a question. I know you're waiting for this to hear back from the schools. Like I know August 30th is for Plainfield East to start, or the 31st. Is that when you guys plan on having everything required to be submitted and paid for prior to that date? And will class start on that date for e-learning?
So for students from Plainfield, yes, their classes will start on August 31st. We work with 10 different high schools over the course of over both sites where we offer the class. So everybody has a slightly different start date this year. So we're going to work with students as they come online and as they start their school year. As far as fees go, that'll be something that'll be communicated as we go. When we bring in our uniform supplier, all fees for the uniforms need to be paid by that point in time. When we're ready to bring in the person that does the criminal background checks, that's when the criminal background check needs to be paid at that time. So it'll probably be a staggered required payment as we move through the fall. I would say if you can pay it by the 31st of August, that would be fantastic. But if you're, again, need to wait until we get a little closer to those things actually being done, that's fine as well. We're just not sure how fast we can get everybody in, and we have to, again, make arrangements with our suppliers and the people that we work with, the vendors that we work with. So that'll all be information to be forthcoming. But if you'd like to pay that up front, we'd be happy to go ahead and get that taken care of for you.
Okay, thank you.
For the medical, from like the doctor, like the TB test and all that, you said to drop it off at Wilco. So even for Lockport Township, even though they're going to be in session every other day, do we bring it to, does my daughter bring it to the high school, or should we bring it to Wilco?
So Wilco paperwork needs to come to Wilco. Any Wilco paperwork that gets taken to the high school or dropped off at the high school usually doesn't make it quite over to us. Sometimes it gets lost, sometimes it doesn't, people don't understand that it needs to be sent here. So if there's paperwork that needs to come to Wilco, we ask either the student bring it to Wilco when they come, or it gets dropped off in the office. For students who are in Plainfield and Valley View school districts, we're going to give them an opportunity to come in to be able to check out their book, to drop off their paperwork, things like that. Between now and the start of school or shortly after school begins. Again, we're going to work with people as we get information and as we can get them in to get them their stuff. But we'd like everybody up and running the first day of whatever their high school starts. But yes, if they're coming to us, they can just bring the paperwork with them when they come to us.
Okay, thanks.
I have a question. So for classes, is it 5 days a week?
Typically, our classes are 5 days a week. We come to our building for approximately 2 hours, and then you would go back to your high school in a typical year. This is atypical, so I know some of our schools are doing shortened days. So again, that's the piece that we're still working out and still trying to finalize the details on. So, but if your school is in session, then you will have an opportunity to come to Wilco.
Okay, but in session, do you mean they're physically there? Because I know the Plainfield district is going remote learning for the first few weeks or through the fall.
Mm-hmm.
So what we're going to do is we're going to work with the students and parents. This is Elizabeth Kaufman, the director. We're working with each of the schools and the parents. We know that some of our parents selected full remote for their students even before the school went full remote. So our wish is that they would come in at least once a week and work on skills. We understand that some families aren't comfortable with that at this time. So we'll work on remediating skills. We just need that communication to occur with the parents to us so that we have our expectations in line on how to best meet the needs of the students and the families.
Hi, this is Rebecca Husk. I have a quick question. I think I plugged it into the chat and I was trying to scan through. Apologies if it's a repeat. Especially as the kiddos get into some of the clinical work and they start to get some exposure. Is COVID testing going to be a requirement anywhere down the line, or how will you handle that if somebody does end up testing positive?
So we have not heard from our clinical sites yet whether they're going to require clinical or COVID testing. Our goal is traditionally students went out once a week for a 2-hour time block. We do not believe that model is a good model during this current situation. So what we're going to look at doing is blocking our clinical time, probably in 6 or 7 hour sessions. And we're going to be working with our homeschools on this so that when we do send the students out, it will probably be back-to-back days for a full day. So that it'll limit the exposure both to our students and to the residents out at the facility. And so when students are at Wilco, we have completely put in place social distancing. So every student, our rooms are set 6 foot apart. And we have all the sanitizing and everything in place. And so if someone would happen to have a positive COVID test, then the others in the room, because everyone is 6 foot apart and wearing their mask, would not be then considered as a close contact.
So are you going to do a fever check?
We are doing a, for students who are coming in person at Wilco, we are doing a temperature screening as they enter the building, yes.
Okay.
At the clinical setting, prior to the schools being shut down back in March, all of our clinical sites were also doing a symptom check prior to walking into the building. Some of the sites required temperatures, some did not. I would anticipate that to be the same in clinical again.
Now, let me ask you this, because I know you have several different programs, and like you said, you have 10 different schools. So are you doing like CNA? I also asked about the MA, but, and I'm asking because I have a mom with a lot of different issues going on. So I'm asking, how are you social distancing? Because I know that they have what I'm trying to remember from when my little niece went, but I know they have the MNT. You know, they have different programs going on. And so how are you having like just the medical come in one day, or how are you doing that? Is it going to be different classes going on?
All the programs at Wilco will have some type of in-person. We have all the one-way hallways put in place, and all the students will exit from an external door, so they will not be in contact with each other in the hallway. So you know, we're following all the CDC and the IDPH and the State Board of Ed guidelines that have been given to us to make sure that we can keep our students as safe as possible.
Oh, okay.
Wasa or Elizabeth, there's a couple of questions in the chat regarding driving to school and if they need a parking pass.
Students will be able to drive to Wilco. They must have a valid driver's license and proof of insurance, and the parking pass can be picked up in the main office.
There is
And
no
there is no fee. There is no fee.
As far as when students are supposed to be at Wilco, we will be working again with administration, making sure that we're signing days appropriately. Again, students that are assigned to come here on the days that they're in person at their high schools will be here For students who are starting remote, we're going to try to give them an opportunity to sign up for lab time and when to come in. We're ironing out those details in the next couple of days. So information about that will be found on the Wilco website, or again, we'll communicate that with families and students once we get information, get them up and going in the Google Classroom. But our goal is to get every student in here this fall working on skills, because without that skill experience, they can't go to clinical, and it's really, really important that the students get that opportunity to come in and practice.
There was a question on the face mask. Yes, face mask will be required per the State Board of Ed and our governor. Probably everyone has heard his announcement last weekend or Friday, but face mask will be required.
For students, let's say at Lockport, who are in school, if I understand this correctly, they're not at Wilco every single day. So then who's teaching them at LTHS? Is like one of your instructors, do they come to the high school?
So what happens is when they're not at LTHS, when they're on their remote day, when they're not even at the high school, then they will log into their Google Classroom, and there will be some synchronous and some asynchronous, which means some in person with an instructor, and then some homework assignments posted.
Okay, but if they are at the high school, does that mean that they're automatically at the Wilco Center that day, or not necessarily?
Yeah, that means that Lockport will be transporting them to Wilco that day.
Okay. And do you know by chance if the buses are for sure taking them over?
I'm sorry, because I was on the Lockport meeting earlier and then jumped on here. So Mrs. Dykes did say the Lockport buses would be transporting those students.
Okay, and one last thing about that. Where would the students meet to get on that bus?
She said they exit out the front doors and the bus picks them up there. I believe there's a flagpole, or, that circle area right there in front of the high school.
Okay, thanks.
There was a question about how to access a theory instructor's email address. If you go back to the Wilco website, and remember I clicked on programs, I'm going to go ahead and do screen share one more time and show you again how to get there. Again, go to programs, certified nursing assistant. Once you know who your instructor is, I am Deborah Bunker. Terry Greenberg is one of our instructors. Amanda Kilpatrick is our instructor down at Braidwood for the Wilmington, Reed Custer, and Coal City students. And then Amanda Ramsden is also up here at Romeoville with Teresa and myself. So once you know who the instructor is, you can click, whoops, sorry, let me do that again. You can click on their name, and then there's a button here that allows you to send them an email. Okay. Right there. So that's how you can email an instructor if you need to reach them at this point.
Elizabeth, there's a question about a child's school is defined as remote. Can they still take the option to come to Wilco?
I'm sorry, my fingers weren't typing fast enough.
Oh,
yes.
You were typing the answer to the question I was asking you.
Yes. So students can come to Wilco when their school is on remote, as far as I've been told so far. And again, I just reiterate, we are still practicing the social distancing. Our goal is to ensure that every student has their own 6 foot of space to be able to isolate in their bubble within the classroom. And so that is why the importance of scheduling and a schedule will be so important.
How many kids are in a classroom?
In a traditional situation, we would have 24 students per classroom at the Romeoville site. The Braidwood site usually has fewer students in a classroom. Again, until the social distancing rules have been lifted, we're going to allow no more than 12 in a classroom so that we can maintain that 6 foot distance.
Can I ask a question about Lockport, just so that I'm clear? So my daughter will be attending school on Mondays and Thursdays, so she'll be bused to Wilco on Mondays and Thursdays in the afternoon, correct?
Correct.
That
Okay.
is correct.
And then on the days that she signs up to do clinicals, she will be driving herself there, correct?
That is correct.
Okay, good. I just want to make sure I had that right. Okay.
So the question is on the sanitizing stations. So each student, we will have a cleaner at each table, and students will sanitize their area on entering the room and before leaving the room. They will also be washing their hands, which is a skill they have to do anyway for nursing. And so when they come into the room, they will be washing their hands. We also will have sanitizing stations in the hall, so they can do that as they enter the building too.
Are all the schools taught together or are they all individually taught?
So usually they're all kind of put together. The way it's working right now this year is they will probably, the Lockport students will probably only be in with Lockport students. We will probably try to group them more by school this year than what we have in the past.
So will Lockport and RHS be work together or?
RHS, because they're doing a shortened day, will probably only be coming in the morning, and Lockport is changing their schedule, so we're still working on what traditionally they're going to be in the third session time slot, but with information I received today, they may be there earlier in the day.
The only reason I'm asking is because RHS has not received their schedule yet.
Right. So the last iteration I saw looked like that their sessions 1, 2, and 3 would be on one day, and then sessions or periods 1, 2, 3, and 4 would be on one day, and then 5, 6, and 7 would be on another day. And so so I was working with the district on what that schedule would look like for our Wilco students.
Okay.
Because a Wilco student from Valley View, their first session is their periods 1, 2, and 3.
Okay, thank you.
You're welcome.
Mask requirements, there was a message about that. Mask requirements need to be, colors is not any color is fine. Again, something that doesn't, have beer commercials on it would not be appropriate to wear to Wilco. But if it has flowers, if it's cloth, that would be acceptable. Medical masks would be acceptable. It just needs to cover the mouth and nose, so that we're containing those areas that we need to contain.
And if anybody, we were given 1 mask per student from the state of Illinois. So those students who are full remote and won't be receiving your mask from the high school, we will have one available for you at the center.
Do students have the option to drive to Wilco instead of taking the bus?
What high school are you from?
Lockport, I'm sorry.
That's okay, because sometimes it's different from school to school. So, and I, again, on the Lockport call earlier tonight, or a conversation I had with Mrs. Kishline, they are going to permit Lockport students to drive.
Okay, thank you so much.
You're welcome.
RHS.
RHS, we have typically, yes, for especially during the remote time. When it goes to hybrid and the district is providing transportation, that'll be something we'll have to revisit. But typically we have let third session students drive every year. And we have considered special medical accommodations for students driving for first and second session.
Okay, thank you.
So for Plainfield East students, because they are not in school, they are able to drive during this time, the beginning of school, correct?
That is correct.
With the, with the parking pass filled out, because I know the parking pass requires a signature by a principal or assistant principal or dean at the primary school. So if you're full remote, how would you do that?
Yeah, don't worry about that. When you get the pieces from Wilco and the parent signature, I will send over them the copies to the high school so that they just have those as part of general record. So do not worry about the school signature if you are full remote.
Thank you.
For Plainfield Central High School, will we be able to show up to the Wilco Center, or is that not available?
No, you will be able to attend lab days at the center. We would like to encourage at least once a week, depending on what student transportation might be. But we will absolutely work with students and family who may not have transportation to get to the center.
I mean, like, for general classes, like just doing the theory classes, would that be?
No, we're going to discourage that unless, for some reason, if you check in and we don't have 12 in the class, our concern is that if everyone came on every day, we would not be maintaining our social distance.
Yeah.
And we want to keep everybody safe.
So how would we like schedule a day that we do come in?
So we are working on that. We will contact each of you to let you know once we get the schedules from the high schools that are all set on who will be eligible to come in what days.
Okay, thank you.
You're welcome.
I have another question. My daughter wasn't able to pick up her schedule on these days at Lockport. Was there any information in there from Wilco for this program?
No, I mean, it's usually just the general schedule. All of our information is on the website.
Okay.
Probably a crazy question, but the socks, the white socks, is there a height requirement for the socks?
No, they can be ankle socks, or they can, come up above the ankle to the knee. That is student choice, but they have to be plain white socks. They can't have cats or dogs or other fun things on them. They have to be plain and white.
Okay, my daughter wears a lot of those like barely socks, I call them, because they just really cover the bottom of her feet. Do they need to be the ankle socks? Just so I know that I get her the right thing.
The barely socks or the ankle, the no-show socks would be fine. The only reason I might recommend something a little taller is that it would protect the skin in case something falls on it. If a glass of juice gets spilled, then they don't end up with, juice in the shoe. The sock will absorb it more. That would be my recommendation, but the pants should come down over the top of the shoes, and so you really can't tell. But I've had students who have worn like the no-show socks and something's gotten spilled on their foot, and now they've got whatever it is all over their foot. So but I would recommend something like an ankle high or calf high, but it is in the end student choice.
Okay, thank you.
Mm-hmm.
Quick question. Let's just say we do end up going back to school and clinicals and everything. Are there lockers to lock up jackets or anything?
No, at the clinical site, the students need to come in just with the things that they need for clinical. We are guests, in a good situation, we have a room that we can sit in to do our conference. Otherwise, we're out in the lobby doing our pre-conference and getting student assignments taken care of. So at the clinical site, no, there really isn't any place for them to put their stuff. They can wear a jacket in during the winter months. So January, February, March, the students would wear, winter jackets in, and we can find a place to put those. But that's all that we have room to store at the clinical site.
And how about at Wilco?
At Wilco, the students are in a classroom, so most of them come in with their backpacks. They have a spot at their seat that they can put their stuff, on a chair or on the floor next to them, but that's it. There are no lockers for the CNA students.
Thank you, Jared.
When students sign up for clinicals, you had mentioned that you're trying to do them back-to-back days. How many hours are those days so that they can work around their work schedule? And what days of the week would that be? Would they include weekends?
It hopefully will only be weekdays, and it would be during the school day that they would be doing that. But we aren't going to know for sure until we get a little closer to that. Like we said, we're looking at a 6 to 7 hour day. So instead of going to the high school, they would come to the clinical site. They would stay there the entire time. They would get a half an hour break in order to eat some lunch, and then they would come back and finish up their time. So their total time at the clinical site for the day would be 6 to 7 hours long.
Okay, thank you.
We have a question.
Oops, sorry, go ahead, hon.
What is the rules on any kind of food and drink during class time while at the Wilco facility?
At this time, there will be no food and drink allowed because of the issues with needing to remove the mask, that kind of thing. So at this point in time, as long as we're wearing face masks, food and drink will not be allowed in the Wilco facility.
We traditionally have taken about a 10-minute break midway through the class. And so if that occurs this year, we will have, and the weather's permitting, we will have the students go outside where they could drink some water, take their mask off, and still remain socially distanced.
Okay, sounds good. Thank you.
So RHS goes back to 26th. What's the soonest they can get books?
We're looking at doing a book pickup for the students on the 24th and 25th, so they would have their books and be ready to go for those students who are remote.
Thank you. Do you pay for the books online, or can we pay for them in person?
If you choose to purchase the books, you can do either or.
Do they take cash or just credit cards or both?
We do cash, check, or credit card.
Alrighty.
For the shoe, does it have to be completely all white, or can it have a little color in it?
So I'm going to show you my shoe. I have a New Balance shoe. Sometimes New Balance has like a little red or a little pink or a little gray here on the end. That would be acceptable. Again, doesn't have to be New Balance, but we don't want like polka dots or anything like that. So if it's 95 to 99% white, that's sufficient. And again, the students are always welcome to bring in their clinical their shoes, or if they buy their own pants, they're welcome to bring that stuff in, and we can tell them whether or not that's acceptable. In fact, we strongly recommend that they not take tags off until they've gotten the approval of their instructor. But again, you want something that's 95, 99% white.
Okay, thank you.
Mm-hmm.
No drawstring bottoms, right?
Correct. Needs to be elastic so that we make sure that it covers everything that it needs to cover. And they need to make sure that they come to the waist. You can't have low-rise pants at the clinical setting.
For the shoes, is there like a basic nursing shoe you would recommend?
Honestly, it's a preference thing. If you anything that's all white is acceptable. You want to minimize the holes in it and no canvas. Again, sometimes those holes that allow for breathing of the foot is great for the feet, but then again, if something spills on it, gets in there. You've got orange juice or something else in your shoes. So we do give showers. That's one of the skills the students need to sign off on. And students who have lots of holes in their shoes end up with wet feet, and then they're going out in February and March and with wet feet to 20-degree temperatures. So it's really a personal preference as to what you want to wear and what's comfortable for you.
Okay, thank you.
Mm-hmm.
How many books are there to purchase?
You do not need to purchase any books. We have one textbook that we use. I don't have my textbook handy at the moment. I apologize. It is Mosby's Essentials for Nursing Assistants. It's 6th edition. It's a blue and green textbook. You can purchase it if you choose. You can purchase it on Amazon and Barnes & Noble or any of those other websites, or you can purchase it from us. But if you don't want to purchase the textbook, you are welcome to check one out, and it needs to be returned to us at the end of the year. And that's free. The checking out of the book is a free thing.
Thank you.
For the students that are on full remote learning, how will they be able to check that book out in order to be able to do their theories on Google Classroom?
Again, we're going to give every student an opportunity to come in to sign that book out from us. So we'll have dates and times in the next couple of days. We were just waiting for some final details from some of our schools. I do have a copy of the workbook. This is optional, so please know the workbook is optional, but the textbook looks identical to this. And it says Mosby's Essentials for Nursing Assistants, 6th edition. We did include the ISBN number on the syllabus so that you'll make sure that you get the textbook and not the workbook. The workbook very clearly says workbook at the top. This is not required, it is optional, but the textbook, which looks identical to this, is a book that the students will need, and they can either check it out from us or purchase it on their own.
Deb, can you hold it up? We couldn't see it. Can you hold it up more to your camera? There, now you can see it.
I'm sorry, thank you for saying something.
You're welcome.
What does it mean for work and textbook? Would you recommend
I didn't understand the question. If somebody else did and wants to jump in, please go ahead, or if you could repeat it.
Yeah, sorry, it's my signal. What's the main difference between the workbook and textbook? Would you recommend the workbook for any reason?
The textbook has the information in it. The workbook has like worksheets, it has matching, it has fill in the blank kind of things. If a student's looking for extra work, an extra opportunity to practice the information that they're trying to learn, I would recommend the workbook. Sometimes instructors will pull something out of it and actually use it in their coursework, but the textbook actually gives the student the information that they need. It looks more like a regular textbook, and the workbook is, again, got activities and things like that to help with the learning. If your student, again, wants extra work or needs a lot of repetition in order to master a subject, the workbook might be helpful.
Is it more study guide?
We do provide study guides and worksheets to help with the learning. That's part of what the students will see on Google Classroom during their asynchronous learning time.
How about stethoscopes? Are they allowed to purchase one?
They're welcome to purchase their own stethoscope. It is not required. We will not use them probably till second semester when we're doing blood pressures. So it's not something that's required, that's needed right away. But if they would like to purchase a stethoscope, they're welcome to do so.
The question in the chat about scheduling, I do know Lockport said today that they're running a shortened schedule for that first week. So the parents were told that the students should follow the schedule in its abbreviated form. So the sessions, it will still be 5, 6, 7, but it may not be at that afternoon time block. It may end up being from like 10 to 11:30 or whatever the shortened schedule is that Lockport's created for next week. That is correct. As far as I know, it's for the first week only.
If students show up early, are they allowed to come in and just wait till the time to start?
If students come early, we will check the classroom to see where our ratio is at. We will have them do the health screening. If we do not have the space for them to join the class, then we will have them wait in the office.
Hello, I go to Bolingbrook. I wanted to know what's the requirements for us because they haven't said anything about us going back to school, but I know we'll be doing remote learning.
For our Bolingbrook students, we will be offering all your theory remotely. We do ask that if you can make it to the center, that you schedule time to begin some of your lab skills.
Okay, and then when does that need to be scheduled, or who to reach out to schedule it?
You will reach out to your classroom instructor, and so we will be reaching out to you to let you know who that is.
Okay, thank you.
You're
Again,
welcome.
filling out that demographics information, the registration sheet off the Wilco website will really aid us in getting in contact with you quickly because we'll have all of your updated information from that form. So if you haven't already, please keep in mind that we would really appreciate you taking care of that either this evening or tomorrow. If you know somebody that missed out on this meeting, please let them know as well that we need that information as soon as we can get it so that we can put everything together. So
one question just
they're on the Wilco website.
Okay, thank you. I'll complete that.
Thank you.
Right. If anybody else has any other questions, please feel free to email us. I know we've been at this a long time, so I do want to wrap up and thank everyone for joining us this evening. And again, like I said, you have our email addresses. Please feel free to reach out and we will get back to you with any information that you need.
Thank you very much, and I hope you guys have a great evening. Stay safe, and we look forward to seeing students here in the next couple of weeks.
Can I ask one quick question? Did you want the kids' school email or personal email for that form?
Whichever one they're most likely to be checking, because at this point in time, it's a way for us to reach out to them and contact them about getting onto Google Classroom if they're remote, about when to come in and get in book, that kind of thing. So whichever email they're most likely to be checking between and say the 10th of September.
Okay, thanks.
Thank you very much, everyone. Again, please feel free to email us, call us if you have any questions. Have a great evening.
Thank you.